The rapid emergence of resistant bacteria is occurring everywhere, endangering the efficacy of drugs. Many decades after the first patients were saved, bacterial infections have again become a threat. The antibiotic-resistant crisis is a well-known problem today. Let us go through an imaginary scenario. Meet Alice. One day she discovered that there is something wrong. She got sick. The next thing she knew was that she is lying in a hospital, diagnosed with a bacterial infection. In order to know which drug and at what concentration she should use, doctors test different drugs against the bacteria that infected her. As of today, all those tests are fundamentally slow, requiring days or even weeks. Our lab, however, discovered a method to shorten this time. The method uses small sensors that are mounted and functionalized using a gluing chemical. The same sensor is then used to attach bacterial sample by immersing it into the suspension and allowing bacteria to adhere. Once they do, the next step is to insert the sensor into the nanomotion instrument with the appropriate growth medium. Now, if the attached bacteria are alive, they will induce the motion of the sensor detected by a laser beam that produces the signal that we observe. By looking at the signal, we can determine if bacteria are alive or dead. Optical microscopy gives us very important clues about what is happening on the sensor. In the case of susceptible bacteria, depending on the drug, it will inhibit their growth, kill them, or even lyse them. In contrast, bacteria which are resistant to the applied drug will survive, divide, and grow. Throughout the project, we have realized several generations of prototypes, each one as an improvement of the previous one. We are focusing the development on the functionality, such as the automation and improved sensitivity, but also the ease of use, having in mind the end user. In fact, we have already incorporated the latest generation into the local hospital. It is being tested for the integration into their clinical workflow. The application of the method produced a variety of scientific papers, testing it not only against bacteria and mitochondria, but also yeast cells and cancer cells. What are the implications? Well, remember Alice? She is no longer in the hospital bed. Knowing the right drug at the right time allowed her to fight off the illness and leave the hospital sooner.